Welcome to the last part of anti-diabetic drugs. We are left with this last topic, which is your SGLT2 inhibitors. Okay, what is SGLT? SGLT is your sodium glucose co-transporter. Okay, it's nothing but your sodium glucose co-transporter. SGLT, there are two types: SGLT1 as well as your SGLT2. SGLT1 is present in your GI tract, whereas your SGLT2 is present in your kidneys. Okay, so let me repeat it again. SGLT is nothing but a sodium glucose co-transporter. There are two types of SGLT, SGLT1 as well as 2. SGLT1 is present in GI tract as well as SGLT2 is present in kidneys. So we'll be mainly focusing on SGLT2. Okay, so this is your renal tubule, which contains your SGLT co-transporter. Okay, so it helps in reabsorption of sodium as well as glucose. So what happens is there is no glucose in urine normally. Okay, so there is no glucose in urine because there is SGLT2 co-transporter, which helps in reabsorption of sodium as well as glucose. If at all we introduce a drug here, called as SGLT2 inhibitor, which inhibits your SGLT, what actually happens? So following inhibition of your SGLT, okay, this is your sodium and this is your glucose, SGLT. So here there is inhibition of SGLT by few drugs. So what happens is there is decreased reabsorption of sodium as well as glucose. What actually happens is glucose and your sodium is excreted in urine. Since glucose is excreted in urine, the blood glucose level decreases. Very simple. There is no reabsorption of glucose, hence there is reduction in glucose in the body. Okay, that's how your SGLT2 inhibitors work. So what are these drugs which inhibit your SGLT2? So these are your dapagliflozin. Okay, then you have your canagliflozin as well as your empagliflozin. Okay, so these are the drugs. They have asked multiple times in your NEET as well as your INI CET exams. Okay, so what actually happens is, since the glucose is excreted in urine, there is increased chance of UTI. This is a question which has been asked repeatedly. Okay, this is your PYQ. So it causes your increased risk of UTI. Okay, since there is excretion of sodium as well as your glucose, what actually happens is there's dehydration which basically takes place. Dehydration, hypotension, okay, and sometimes they may give an image of gangrene. Okay, then sometimes they may give an image of gangrene, and they may ask which of the following drug is causing it. Of course, due to UTI, there may be your infections as well as your gangrene taking place. Okay, extremely important. So UTI, dehydration, hypotension. And another property which has been asked repeatedly is one of the anti-diabetic drug which is used in CHF is your SGLT2 inhibitors. Since it causes your diuresis as well as natriuresis, this may be one of the property which is useful in your CHF. Hence, it is one of the first line drug which is used in your congestive cardiac failure. Okay. And then another important property which will be taught in anesthesia and other subjects is SGLT2 inhibitors are usually avoided on the day of operation because there is increased risk of euglycemic ketoacidosis. Okay, so hence you stop SGLT2 inhibitors 24 hours before the planned surgery. This is also another very important side effect as well as important point to know. Okay, this is all about SGLT2 inhibitors. So let me summarize it. Your SGLT means sodium glucose co-transporter. Okay, there's SGLT1 as well as SGLT2. SGLT1 is present in GI tract, SGLT2 is present in your kidneys. Okay, so normally SGLT helps in the absorption of sodium as well as glucose in renal tubule. If you give a drug which inhibits it, there's decreased reabsorption of sodium as well as glucose, hence glucose is excreted in urine. Okay, so this is the main mechanism of your SGLT2 inhibitors. So side effects being, since glucose is excreted in urine, there is increased chance of UTI which is taking place, and there may be infection as well as your gangrene which may be seen. Okay, this is a PYQ. And since your sodium is excreted, there may be dehydration as well as hypotension which is seen. And since there is properties of diuresis and natriuresis, hence it is used in CHF as one of the first line drug in CHF. Okay, so this is all about your SGLT2 inhibitors.